I've been a provider here for about 16 years, and what was key was we recognized that seeing patients one-on-one, there were a lot of social determinants of health that we needed to address.
By definition, a health inequity is something that's preventable in jest. It's a difference in health outcomes. So when we look at communities where there's high concentration of people who are low income, we find that predatory lending sites target those communities, fast food targets those communities, and this often leads to individuals not having the opportunity to make healthy choices. So it leads to inequities in diabetes, obesity, hypertension, all of these chronic diseases that you think of that are prevented by eating healthy food and being physically active.
When we talk about the work that we do, we really always talk about policy, systems, and environment. So it's a combination of all those three factors that affect whether a person has easy access to food, easy access to exercise, for example, easy access to care. So the food pharmacy is a program that we have where providers actually refer patients who are food insecure and need some, extra help when it comes to managing their chronic diseases. So they're able to shop here for free for a certain amount of time, and then also get different supports when it comes to like nutrition education, for example. So we have cooking classes, we have nutrition classes, so that they're able to kind of get that whole holistic support in this types of space. On a weekly basis, across our both sites, we serve around 200 patients. Those 200 patients represent about 59 different clinics that Presbyterian has in their service.
Healthy Here has been really key for us in partnering in the community, being informed by community organizers, being informed by people who are on the ground and really experiencing the barriers to improving health in their communities. They know the priorities of their communities. So we worked with them to really understand what are the barriers to being healthy, and they help to inform us on how we design our programs, where to hold them, how to connect people to them, how to advertise to them, all of that.
Being a part of the community, I'm able to bridge gaps that Latinos and our Hispanic community are afraid of utilizing, and seeing the success that they are encouraged to come and visit and try out the resources we have through Presbyterian, with the food pharmacy, with our chronic disease self-management programs. They learn how to manage it themselves versus trying to rely wholly on our providers. But as a community health worker, we're the missing piece where we engage and build that trust with our patients, our providers, and our community.
To be able to have a team that's invested in our community and invested in the providers and the clinical team, I know and I feel confident that if I don't know where to refer this patient to, I have a team that's going to help me, in essence, support me to find that. And if the resource doesn't exist, we've been able to leverage our community to be able to identify gaps in care for those programs and to be able to really leverage, I think, the county, the city, the state to offer that.
My experience has been life-changing, to say the least. Once I found out I was diabetic, because I'm a cancer survivor, and it hit me by surprise that I would have become diabetic after I worked hard at being healthy. So I wanted to be able to control my A1C with diet and exercise. And so when I heard of the Wellness Center, that's where I went.
Getting Further Faster has been really key in helping us to measure how are we improving outcomes for patients? How are our communities better off? With the help of Getting Further Faster, we're really excited about the tools and materials we will have to share our successes and to share what we're learning across the country to other healthcare systems and to continue to improve the work we're doing locally.